It's some 33 minutes after 7. We're talking World Health Day. It's a very important day for the World Health Organization because it's the anniversary of the founding of the World Health Organization. The day also provides the opportunity to throw light on specific health topics of concern to people all over the world. And this year also marks the World Health Organization's 70th anniversary since its establishment. The theme for this year's celebration is universal health coverage, everyone, everywhere. The theme for this still remains health for all. And our emphasis will also be on how the Ghana Health Service seeks to control employees whose actions cause the needless deaths of patients at hospitals. Okay, so let's just introduce to you our guest, Alhaji Sufyan Abubakar, is Deputy Chief Health Promoter with the Ghana Health Service, and also Chief Superintendent Marufatu Esibrima, Director, Nursing Services, Police Hospital. So good morning to you both.
Good morning, Mama V and my gentleman.
You started screaming even before we said good morning to you.
Mama V is a bad girl.
I don't know.
That's Roland Walker.
Roland.
Madam, how are you? Good morning.
I'm fine.
We're
Popular
going to have a
Roland.
great conversation.
Yeah,
Sure,
it's good to have you
Because
both.
many of the times we know that issues relate to all of us. You may be the professional in charge of certain services or activities, but at the end of the day, you're also a Ghanaian citizen, and health is a concern for all of us.
Sure.
So let's start. Let's make you very comfortable. Why should this day be of concern? We know that. Why should World Health Day be of concern to us, particularly with this theme?
Thank you, Mama V.
Yes.
We are very grateful to the Ministry of Health and the Ghana Health Service, and especially Ghana Police Service with my medical director, Dr. Edi Musa, in the chair, for allowing me to come here this morning. Yes. Today is a great day for us, globally for everybody, because it's a World Health Organization Day. And 70 years ago, World Health Organization brought a great idea that there should be health for all, wherever you are, irrespective of your status, your race, your creed, your color. Health must reach you. And we started this journey since 1948 till now. And somebody will say, why the health is not reaching everybody? But I tell you, it's a great day. And this year, every year they bring out a topic, a theme. And this year, that's what we have said. Everyone, everywhere, wherever you are, in the village, in the cities, the health must reach you. And there should not be any financial barrier to accessing your health. We are using universal health coverage, which includes promoting health, preventing diseases, curing diseases, rehabilitating people, and name it, at a low cost, using information. It means we have to educate you. And there should be a very big political will. Yes.
So, you've painted a very nice picture. This is it, universal
and the
everywhere.
individual too.
Okay. So, Alhaji,
And the individual too.
Is this what exists with our healthcare delivery in Ghana? Let's bring the conversation home.
So, but before, thank you for the opportunity. But before we go to your specific question, I just want to top up. Even at individual level, you know, we organize birthdays.
Yes, we do.
So if a 70-year-old man deserves, or a woman, it's a great day for somebody to live up to that. And now we are refocusing on the original idea of establishing World Health Day, the World Health Organization, who seeks to ensure that there's health for everybody, everybody, everywhere. So that is it. And every year, a theme is selected, which is of public health significance. That is, and for this year, we have universal health coverage, as already explained.
So back
now to your specific question.
Exactly.
As regards to
what exists
home.
Yes.
You know, just as we all know, that you don't just think of something and it happens. We were somewhere and we are moving towards another place. We are in transition and we know that our indicators used to be like health indicators. What our level of or health status, the coverage and everything was worse off in times past. These days, there are people doing medicine in our medical institutions, and they are looking for a live measles case they can't find, live whooping cough case they can't find. A few years back, these diseases, the 6 childhood killer diseases, used to kill a substantial number of children in our country.
Okay, so apologies for that.
So sorry for that.
But you have to completely put your phone off for us. Okay, so you're saying that we're not where we used to be.
Yes, we have progressed. We have made a lot of progress as a country. And even of late, as you can see, we have these very good national policies that are on course. We have the case of where as a policy, every region is supposed to have a regional hospital. We are on course in doing that. Every district has a district hospital. Yes. We are on course in doing that, except that the new districts that we haven't probably gotten all of them. And we have this wonderful concept which falls exactly in line with universal health coverage. The concept of community health planning services. That's the CHIPS, which we are very well on course. Because the nation has seen it as a priority, we have prioritized it. We are doing what we can do as a country, and we are even getting support from other countries to sort of bring health service closer to the people. So if you compare the number of CHIPS compound, for instance, from now and 5 years ago, you would have seen that we have done a whole lot of increases in terms of progressing towards universal health coverage. Okay. I will assure you that we are not there yet, but we are moving towards.
Is there a timeline? When would we get there?
Oh, there's no, as at now, we cannot say we will get there at this time. All we know is that we have put systems in place and we are working towards there. That falls also in line with the Ministry of Health and Ghana Health Service, our performance objectives. We have some objectives, and it has to do with access, increasing access of services to the general populace, and we have been working on that, and that is what is expressed in the CHIPS concept, and we are moving towards there. We are making progress.
You wanted to add something?
That, yes, that is why we are saying that to achieve this universal health coverage, we must use primary health care. That is service that is available, affordable, accessible, and of quality. Yes. Wherever you find yourself, with your cancer, with your non-communicable diseases or communicable diseases, when you go to my village, the services must be there, and they have to be of quality. And that is why the government is training health workers, training and retraining, ensuring that we are skillful, ensuring that the structures are there, as Alaji said, the institutions are there, sending the facilities to you.
I want to play back a clip, because we had a guest on our show sometime last week. We're discussing mental health, and she shared a very heartbreaking story with us on the show. I want to just quickly play back that clip, and then we'll carry the conversation from there.
Okay.
You are the reason that they are here, really, because of the great collaboration. But you also came and encountered not so good news. In fact, it is absolutely bad news, but you're still on this project. Tell us what happened to you and your mom.
Right. We came to Ghana to launch Bestow Foundation, which is something that we've been planning for a long time. A very happy event. My mother came earlier, and then her role was to do the votes of thanks after the luncheon. It was all planned, it was beautiful, and we decided to spend the Easter together. I left on Thursday, and then I came knowing that I'm going to see my mom the following day. Friday morning, I put on my phone and I got a text message, "How are you?" following the news of Christine Gogo. And I was quite shocked. What is going on? I called my mom's phone, and the response I got was not encouraging. I went to my mom's house. When I got there, I was told that mom had a tightened chest on Wednesday. They took mom to the 37 military hospital. She was sent away, no bed. They then took her to the Ridge Hospital. She was again sent away, no bed. And on the way to police hospital, I lost my mother. That was so heartbreaking. And it's a failure in the Ghana medical system that somebody, we all Ghanaians in the diaspora come into our motherland on holiday, and when we fall ill, we cannot have the basic medical care. She had insurance, she's a British citizen. She could have gone home for treatment, but she needed to be stabilized, and Ghana system failed her. I take this platform and the opportunity to plead with all my brothers and sisters in the medical field abroad. We should all put our heads together.
So that was Stella on our show last week. What would you say after hearing that? This is not a one-off.
It happens all the time, especially in the public hospitals. Let's not even talk about the private hospitals.
No, but to begin with, I would have preferred that we focus on our topic for discussion, which is World Health Day. And
Absolutely.
we are here to raise awareness about the day.
And you have a fantastic team.
Yes.
You've got a universal team.
Yes.
Healthcare for all, everywhere.
Yes. Everyone, everywhere.
Everyone, everywhere. So
Yes.
this absolutely fits in.
Yes.
We haven't gone outside the theme.
Yes. But like I'm saying, as much as possible, these are, like you are saying, they happen every now and then. And every system, every growing system have challenges. And these are some of the challenges we also have.
Well, we've been
in our
having these
system.
challenges for decades, wouldn't you
Yeah,
say?
we've been having these challenges for long, but we have
No end in sight.
There's end in sight. There's end in sight.
Because you even can't give us timelines.
Okay.
No, there's end in sight, but we are working. We are working towards solving such problems. I know we're putting in a system in place to have all these facilities, hospitals networked, and to declare vacancies at any time, and even try to get a site that you can always access the availability of facilities before you even move.
But what is the policy? Because I know that not too long ago,
yes,
the former, just the retired Director of the Regional Health, Dr. Vanotu, there was a directive that she shared with us,
yes,
that no bed should not be an excuse.
Yes.
And that at least stabilize the person.
Exactly.
Whichever way. So is that thing still in place?
It is in place. And even beyond that, we are trying to help the public to know exactly where to move to, just at the click of your phone, which was being seriously worked on, is still being worked on by our IT department. Yes,
okay. You
to the best of my knowledge, we haven't completed. But like I'm saying, these are some of the maybe challenges that we have. And remember that with all these things, there are individuals who are so trained, and they are supposed to behave professionally. But sometimes we have people behaving otherwise, and we can't explain.
So I just wanted to say that I am happy about the birthday. I'm happy about the 70th anniversary.
Yes.
But I am also worried as somebody who could potentially fall ill at any point, and I could be carried to anywhere. Yes. I could be taken to 37. And
Police
what happened
hospital,
to Stella could happen to me. They could say no bed. I could go to Ridge, no bed. I could go to Kolebu, no bed. And I could just simply die. So as much as I want to be happy about the fact that we're celebrating 70 years of WHO's this whole birthday of World Health, exactly. I am also a very worried person inside.
Yeah. We want to. That is why we are here today, with this universal health coverage, and it's talking about financial access. In fact, we have infrastructure deficit, as you have said. They say no beds. Police hospital, yes, our name is big, but we don't have beds, many beds. So at times you come and you see people in a wheelchair, assessing care, in ordinary chairs, and even the stretchers, in ambulances are used to nurse clients on. It's just unfortunate. And we have a new police hospital coming, the building.
It's been coming for a very long time.
Yeah, it's been coming. That's what I'm saying, it's coming.
It's been coming
so
for years.
That's why we are here. That are coming to appeal to stakeholders to come and support us financially, because if you want health to reach everyone everywhere, irrespective of your disease, then we need money. So that is why we have come, appealing to everybody, all Ghanaians, anybody at all who can help us. I mean, there's need. And also for the national health insurance, the woman talk about national health insurance. How many of us have it? We don't have it. And it's a pool. Your small money, my small money, others coming to help us will let us have money so that we can do a lot of things. That is why today we are here, appealing that financial access is very, very important. Let's build the infrastructures. Let's train and retrain the people. Let's do something so that we won't hear this story. We are actually apologize for what happened.
No. You know, the story that we played, or the incident that we played, is not necessarily to put a spotlight on the Ghana Police Service and the police hospital.
No.
But let's get the issues into perspective. We're all people. And before the start of this conversation, Mamavi and I were even saying that we all ascribe to regularly attending for health care services at private hospitals. But when we have emergencies, it's where the health system could fail us. Now, let's all talk as individuals, not only those of us who hold positions. And let's be real. Why do you think that we have some of these difficulties in accessing emergency health? Is it because the people are bad? Is it because there's the lack of the facilities, etc.? Let's be real with each other, because that's what the theme is all about.
Yes, but
no.
The lack of facility is very, very important. Yes, because for instance, the person said military no bed, and police hospital. As I'm sitting here, maybe if you go there, you will see that yes, the beds are all full, and then people are lying on the corridors. Yes, patients are lying on corridors.
Because you don't have the space.
We don't have. And you know, ours is even serious, because they bring any accident case, it's police hospital. You understand? So our beds are almost always full. But then that doesn't mean that if you come, we can stabilize you. We have to do something. Even in the car, we have to do something. We do it. Yes. So we can send you away.
You're a chief health promoter. Is it that the attitudes of the health personnel are not right? Or why is it that even though we have difficulties, which we all know, we are not able to, treat the emergencies and even the regulars at the open?
Yes, we have long discovered attitude as a problem, as a result of which we have put a number of interventions to try to check or get the system working. But all in all, like we are just discussing, the theme, as we are discussing, universal health coverage, brings out the fact that there are challenges in attaining universal health coverage. And it is those challenges WHO has promised to support various countries. And what you just showed is one of the challenges. These challenges have been recognized globally. Some countries have been able to solve them, and they are improving. Some of us are still in the midst of the kind of situation you have just shown. But we are also working to achieve them. And for this particular occasion, the universal health coverage theme is supposed to run for a whole year. Every year, the theme for World Health Day runs for a year, and there's a pack of activities, interventions. The WHO at the global level is promising to help countries to carry out or draw their programs and strengthen their programs to carry them out. But the most important thing is this idea of always looking at someone else's life. For instance, yes, Ghana Health Service, or for that matter, the health system is responsible for certain things. But this occasion also calls on us to bring out the role of individuals, the role of communities, the role of the media in sorting out such problems.
What should
so we all have various roles to play, including the media.
What roles should we assign ourselves, and what roles should we play?
Or it's not for the media, for instance, at the individual level. Let me start from the individual level, where you are responsible for your own health. You are supposed to behave and take actions that will make you healthy. Like, for instance, basic things that you shouldn't do, we see people doing every day. What food do you eat? What is the basis of the selection of the food you even eat? How are you taking care of your health? How often do you go, let's say, for a checkup? That is at the individual level. And at the individual level, once again, you are supposed to even sort of sensitize people at your community level to want to have some health services if you are in a remote village. But we have under the CHIPS concept, which is down on the ground for the various communities. We still have outreach clinic. Every CHIPS compound also still leave the compound from time to time and go to outreach. Still, so at the individual level, at the community level, you can lobby to have such facilities. And now, I've spoken on the individual, I've spoken at the community level. Every community should be desirous of having some health services. Now, coming to the media, you have a very powerful tool, and you can influence things. You can do advocacy. You can do a lot of, like the video you just showed is something that, I mean, calls for action. You do your research, and there's a lot of information out there that you can put on screen to to influence policy. Yeah, very powerful people, and you have a role in working towards universal health coverage.
Okay, and to add to what Alhaji has said, yes, I must commend the media for doing a very great job. Because when the Sustainable Development Goals started, 2016, you took it up and you did very well, knowing very well that our president is in the chair for the Sustainable Development Goals. And we are talking about good health, 17 goals, which are all interrelated. And the health, we say good health and well-being. Universal health coverage that we are talking about is about what? Sustainable communities. It's about reducing poverty, epidemics. Hunger. Ensuring that everybody is well. That is why. But today, what do we see? We litter our gutters to the extent that when there's little rain, we get flooding. This flooding can cause electrocution. People die out of this. They get drowned. Are we promoting health? We are not promoting health. When cholera comes, it kills many people. Ghanaians, let's be realistic. We need to promote health.
That is
okay.
So that at least.
I think that is.
So you're coming. So you're still
yeah.
talking about the
self.
Yeah.
And then we have
at the individual level.
And the media. That's what I'm saying. Everybody is doing very well, but all that the whole world is watching us. I am very particular about this because our president is in the chair globally. The 194 countries that form the UN. It's our president. It's a co-chair. So everybody is looking at him. The Galamsey fight that he is doing it so that, number one, we can have potable water to drink. Number two, we can avoid the cancers because the chemicals that we are using to do mining is causing cancer. The same bad water, they are using it to water our vegetables. You eat it. And when you, our mothers are giving birth to children with deformities. And we say we don't understand. We must understand it now. We have to prevent this diseases and promote our health. So
okay,
that is it.
Right,
let's act responsibly.
So let's talk about you. You sure do have some activities lined up.
Sure.
How are we marking this day?
As a country, we plan to have on the 11th at the international at the Ministry of Information conference room a press conference that will be the launch of the activity. Beyond the launch, We have post-launch activities. We want to sustain the level of awareness of universal health coverage and try to clearly come up with what the individual should do, what the community should do, what the media should do, what the government should do. We are trying to clear all these things and reassure everybody of the overall support and coordination by the World Health Organization.
Okay, let me take you back to emergency response. What should the attitude be? What is the plan? What's the laid down plan for emergencies?
Emergencies as in, because we have various forms of emergencies.
Oh,
for instance, if you have
you suddenly fall ill and you have to be taken to a facility.
If you have a vehicle crash, it's an emergency. If there's an infectious disease outbreak, like we had one case of Lassa fever, but it died down.
Okay.
You know, some diseases are said.
So why don't we take?
That is why I'm asking which angle you want us to come in.
Let's tackle all the emergencies that you've mentioned. Let's start with accidents.
Accidents, for instance, that is why we established the Ghana Ambulance Service. The Ghana Ambulance Service. And you know, we learned our lesson the bitter way after the May 9th stadium disaster. Am I correct in the date? So we had to bring a whole system. And as at now, at least the system is there. And we have some ambulances, which we used not to have at all. But now we have some ambulances that you can call.
So again, we are not where
that is,
we need to be.
Exactly.
But we are also not where we were before.
Exactly.
Yes. Okay.
That has been my argument. We have diagnosed the problem. We know the problem. We started something. We are moving forward.
Okay. So how about
for infectious disease, you have a national preparedness and response plan, which clearly defines the role of the various thematic areas. Like we have the coordination wing or pillar. We have the case management. When we find it, we have surveillance and laboratory that will sort of identify whatever case. And we have the risk communication component. These are all well-established systems in the National Preparedness and Response Plan. And we even have, with support from the WHO, we have training. We have training on the we have a national rapid response team. And beyond the national, we have trained regional rapid response teams. Giving
do we see all the things that you're saying effectively working on the ground?
Seeing them is for you. I am telling you what we have done. So it is but you to see, and then we'll see whether we are effective.
Because what we see,
you are watchdogs.
But you also encounter.
You are the watchdogs,
okay,
isn't it?
So let's give him a report now. Let's tell you that the picture that you're painting is so nice.
Yes.
And we wish that was what reflects on the ground. Because with this issue of Lassa fever, I mean, it goes round and round and round and round, and you're even wondering if the nurses who are attending to these patients are aware and they know the consequences. Do they even,
Oh, now they know. Because now, in every OPD, things that used not to happen are now happening. For instance, we do triaging. At the OPD, people were always boxed together. In these days, the nurses have been, she is a nurse, she should even take up, they have been trained. And right at the OPD, you do a quick scan to pick out people who are like showing signs of an infectious disease and separate them immediately. Yes.
Please, is that what happens?
Yes.
Or is that what's supposed to happen?
Because, but perhaps that's with the big facilities. How about, because we're talking universal.
Yes.
So does that include all the clinics, all the other facilities, the small facilities that we have around?
The small facilities are also trained, and the people there, if it is a physician assistant, if it is a community health officer, they know their limits.
I'm yet to experience what you've just said, though,
they know their limits.
You're in the OPD and they are hand-picking people who the suspects may have. I haven't experienced that before.
And then
there's several OPDs.
You are separated or given special treatment.
You are not always at the OPD.
Yes, but I've been to several.
You are the office. Big man, that condition. We go to the hospital.
I want to say that what Alaji says is true, because
on paper,
at times you don't understand why somebody has just come and is being sent to see the doctor. We don't have to tell you why we are sending, or at times we say it if it is necessary.
What we know, it's good because, you've even brought this. Sorry to cut you. What we know is that a queue is formed. It's first come, first served.
Exactly.
But there's also another practice where some nurses would pick people who are not necessarily, it's not that they have an emergency, but they are picking favorites.
How do you know? How do you know? How do you know it's not an emergency?
I have a real experience, and unless I don't want to mention a facility,
and that would be even if you mention the facility, that would be fallacy of overgeneralization. You can use one case to exemplify as if that is the
that's the reality. That's the reality.
That will give you a clear. So these are women who are going to, pregnant women who are all going to see the doctor. And then suddenly, somebody who came at 6:30 is still sitting down. Somebody who reports at 8
and if
has been crossed. So the nurse, and you know, when the nurse picks a patient, you don't question the nurse.
That's why it's not about health service. This is a general problem you are bringing up,
but it's still health service. I'm just trying to.
What I'm saying is that it happens in all other. It happens in all other areas.
So
like for instance, if Roland gets to a place where he's a popular person, everybody knows him, he will get services faster than. It's not only with the nurses and you.
So you are aware that
you have been benefiting from that system.
We're talking about
is that way.
No, what are you saying?
That's also the worry. That's also the worry.
That the ordinary individual in some
should an ordinary person suffer because some famous person or somebody who knows a nurse or who knows a doctor?
And that is a broader discussion which should not be linked to, which should not be narrowed down to.
It is still the universal healthcare everywhere.
Yes, but it goes beyond health. Services are offered across board everywhere and within every facility. In our African system, it is about who you know, it is about your brother, it is about your sister, and those who don't do it are being accused.
So this has come to be accepted.
It is not accepted. No, it is something that is happening, and who defines whether it's normal or not normal is for all of us. And I'm sure as we are talking, you have been benefiting from that kind of system. You
know, I am surprised that you're pinning this on me.
No,
because if I was benefiting, I was so excited about it, I would even talk about it.
Are you sure?
Yes.
No, but you are talking on behalf of the public, isn't it?
Yes. Absolutely.
I want to assure you that nurses are not there to cause delay, because delays are very dangerous. You know, when somebody is sick, or before even the person comes to the hospital, even he's delayed in even thinking of how to access healthcare. So at the hospital, we try and do our best. But as I'm saying, we do triaging, ensuring that the seriously ill patients or those that are infectious, especially children and the pregnant women, they don't sit among the people for long. So you see this as it's a favoritism. But I'm telling you, that is it. We are doing triaging.
Really?
So we are sorry, certain times you don't have to say it. You know, we have the clinical eyes. We have to clean that,
and we are the judges. Well, it's not because you're favoring them.
No. We are not favoring them. But our clinical eyes are telling us that we should move this person from here to this place. No. But at times we explain it. And information is very, very important. If you don't explain it to the person will think that you are being biased or something. So, in fact, all that I want to say is that please have faith in us. We are there for you. We are there for you. We are not there to, cause harm to you. Yes.
Okay. You know, Roland, last week, one of the other disturbing issues was also the
that's police hospital.
This is your hospital.
This is a police hospital.
Yes.
Okay, the Princess Marie Hospital, where... The
Princess Marie Louis Children's Hospital.
Exactly, that's a children's hospital where there were no doctors. And, you know, and we want to just bring back that as well. Adelaide Arthur covered that for us. Just a reminder.
You must do something about this. It's not good. What is going on? It's not good. People will die.
When they like, they come. If they like, they don't come. Then you come. Since morning, I was here since 7:30. Look at me, I'm still here. What is that? Only one doctor. This one will come and leave before the another one will come. It's too much. It's too much. The children are suffering because of the children's health that they are here. They pay them. So they have to do the work wholeheartedly.
He is vomiting blood. And my mother called me from work to come and take him to the hospital. When we came this morning, there is no doctor here. We have been here since.
And what did they tell you?
Nothing. We are just sitting now. The doctor is one, and the people, you can see how many people are here. People, we are many. So it takes time to look at them. And this is emergency. He needs to be taken care of.
How old is your child?
10 months.
I was told the doctor on night duty will attend to us at 8:30 p.m. But I told them I couldn't wait. But they assured me my children will be attended to. But I've been waiting since. My baby keeps crying, so I brought him to this hospital yesterday, and he was given medication. But his condition remains the same.
Oh, they know him fan. Now they know coffee saying so almost say train kakra my doctor no non show.
I am taking my baby home. It doesn't look like I'll get to see the doctor tonight. And it's not safe to be out there at night with a baby.
Hospital for Frana.
The doctors don't care about seeing to patients who come to government hospitals. They are busy with their private practice, but they gladly receive payments from government. I have been here since morning on an empty stomach just to seek health care for my sick child. How will I be able to produce breast milk to feed my child?
Parents are angry. They are frustrated. They don't understand why only one doctor should be on duty in the afternoon and in the evening. They want authorities to do something about this situation. Adelaide Arthur, Joy News, Children's Hospital, Accra.
Okay, so we're back. This is, the picture at the Children's Hospital. And then we had parents there speaking to our colleague Adelaide Arthur, sharing their frustrations with her. Indeed, it is frustrating, really frustrating when your child is not well. You take your child to a children's hospital, and for the whole day you have not seen a doctor. We must say on record though that there were nurses available.
And even it started from morning, and the patients started complaining. We went there towards the latter part.
So we're bringing this back to you because you said that as media we have a responsibility, and we're trying to paint the picture to you.
We even bring them from up
that that we've been doing the monitoring. On this day, we find that this is a very good day for us to be talking about all these issues.
Important.
So if a parent encounters this, what can they do? What can they do? What do? You go to a children's hospital and there's no doctor. You've been sitting there the whole day. What can you do?
That is a major, it shouldn't happen.
Oh, it's been happening.
It shouldn't happen. And for such things to happen, I don't know. Because the major statement that there was no doctor should not even be the worrying thing. If there was no doctor, were they being attended to in any way? But like you are saying, certain actions can be taken even in the absence of the doctor. The nurses are always in charge, and sometimes for this particular occasion, this is a specific thing. Because I don't have the details, I don't think I can.
I'm just saying
I can
that
respond to it
appropriately. Like if you go to a facility and they say there's no doctor, this is just the backdrop. But if you go to a facility and they say there's no doctor, you're saying that shouldn't happen.
The administrator should be able to, make an alternative arrangement. And if there's no doctor, it should be, the issue even goes beyond what you are saying. Were the people was there any communication between the hospital and the people? They should be talking to them. This is what we have been talking about for some time, trying to sort of rebrand, because these kind of things we have seen, sometimes they happen in the system. We've taken note of them, and we've been bringing about interventions that will reduce or even eliminate these kind of things. These are some of the problems, maybe human factors. If a doctor is on duty and can't come, anybody can be taken by surprise.
Okay.
But you should at least inform whoever is there for an alternative arrangement to be made.
Okay. Let's take some of your messages on WhatsApp and then regular texts. This one says, good morning. Please, my question to Alhaji is that, what should we do if a patient is sent to a hospital and we're told there is no bed? Thomas, it's at Sampa, and he's asking the question, Alhaji. If you go and they say no bed.
It's not there.
Alhaji, Thomas specifically said my question.
For Alhaji.
Alhaji, yes. If you go and they say there's no bed, what should you do?
You see, it's always so sad. And like you are saying, it can happen to anybody at any time. I have personal experiences of these kind of things. But number one, it is not good, it is not right for somebody to be denied or to be sent away just because there is no facility. So if you go and it's like that, we are just even working on our code of ethics. We have just the code of ethics for health professionals. We have reviewed, and we are trying to disseminate it more widely, such that now there are
so
books.
This one,
now there are
the
books.
no bed situation is the wickedness of the people at the facility. Is that it? Because there's something that you could always do. You can even just, I don't know.
Yes, just put even because it's not about bed, it's about stabilizing a person.
Exactly.
Maybe the nurse should.
Let me read some more messages. This one says, please
but
tell
if
them.
I haven't finished my answer.
I get it, but the message is also very important.
Yeah, but you need to know your rights as a patient. You need to know your rights.
They call me. They call me. I know my rights. So you are telling also, please go ahead. Go ahead.
So that is why we have reviewed the code of ethics, and now we are making it into a wall chart, and we will paste it at every health facility.
But
including the chip compound.
Including the chip compound.
The question still is, if they tell me, irrespective of what you've pasted there in the open, if I'm told there's no bed.
That is what we are working on. We are moving towards a situation where you, the professional, will know that it is unprofessional to say there's no bed.
I want to add
so they are engaging in unprofessional practice.
Nobody can deny anybody if there's bed. It saddens me when I listen to this, because I work at the police hospital and I know the efforts that we put in. I am saying that as at now, if you go to the police hospital, clients are on, the medical director have provided improvised beds on the corridor. Can you imagine nurses sharing the corridor with patients? Some of them sitting on chairs, sitting on wheelchairs and any other chair, even plastic chairs, assessing healthcare. In fact, it happens to even our own police officers. We have to refer them if there are no beds. That is why we are saying that today we have come to appeal to everybody. Police hospital, we have a big structure. It is not in my domain to say this. But if it were to be there and the nurses are available, I think we can absorb some of them.
Okay.
Yeah.
Let's read.
So I don't think any health worker will pretend beds will be there and will pretend that there is no bed. It's inhuman. So it saddens me when I hear that there are beds, but they send patients away that there are no beds. Oh, please.
So you're saying it's because the facilities are not.
Yes, the infrastructure. It's not there.
Somebody is asking that you come to Bunu Ahafo, even at the regional hospital at Sunyani, all their ambulances have broken down, not to talk about municipal hospitals and professional attitude of their staffs. It's a shame for them to celebrate this day. Okay. Timothy Brekum sending this message, greeting staff of Presec as well. Timothy, thanks for your message. This one says, mothers. Okay, let me read the first bit. Germany's healthcare system is the #1 in the world because Germans invest a lot in their healthcare delivery. So pathetic in Ghana. Healthcare in Ghana is really poor. The government of Ghana should invest in the healthcare system and stop buying expensive V8 cars for MPs and ministers of state. Samuel in Germany. Samuel comes back to say that mothers take their kids for medical care and there's no doctor at the hospital to provide medical assistance to these sick kids. And we say Ghana is at 61. It's a bit unbelievable when you box our issues together like that, Samuel. Thank you for the message. This one says, somebody disagreeing with you, Alaji, says he seems to beat about the bush when questions are thrown at him. So face the questions straight on for us, Alaji. This one says, Alaji is talking like a politician. The health system is not as he's painting it. We have serious issues. There's nothing like universal health care in Ghana. We're not progressing. We don't have enough hospitals and health personnel. We pay huge sums of money for ambulance services if you're lucky to get one. So these are people who are actually on the ground, who experience what we're talking about, who are sending the messages. John Okanse in Pando says, how many doctors are actually working at the Children's Hospital? Could it be that few doctors and nurses are just seeing too many patients? The nominal role should be taken for all the health workers in the country, and in smaller facilities where there are too many doctors and nurses, they should be reassigned to where they are needed most. John Okanse in Pando sending this message. This person says, oh, okay, so that's Virginia, who wanted Alhaji to speak more to the questions that are being asked. Okay. Dr. Dodoy says the no-birth syndrome cannot be solved by a political policy. The health professional will not be spared his or her license if you admit to say a chair and there are lapses in your management.
You see?
Thank you.
Thank you. Yes, it's true. It's right. These things, yes. We shouldn't have done it. We shouldn't do it. But
so it's unethical idea.
It's unethical.
Yeah.
But
the facilities
is it not better than sending you away? That is the dilemma we find ourselves. Fact, that's why I'm saying that it saddens me.
I think the directive that I remember was issued was
we shouldn't do it.
If it's a bench that you can, like a makeshift
the bench,
just to stabilize the person,
but not in the chair.
Find out.
But that is it.
But
is it not better?
But Roland, if that's what's available, instead of sending you for you to die on the road, which is better.
That's why I say it saddens me.
But the point is, can I ask a practical question? After you stabilize, do you call other hospitals to find out where there is space?
We have a network. We have a network. We have a network. Yes. Reach,
Police hospital can easily find out from Kolebu if they have them, that working
even before you refer a patient, you must call to ensure that they have best available.
So I think the one that we have issues with mostly is the one where the person has fallen ill either at home or work or wherever. So it's not a referral necessarily from one hospital to the other, but it's the emergency from home or wherever to the hospital where they tell you no bed, no bed, no bed.
Yes.
Okay. This one says the same thing happens in Yendi. Please, we need your assistance. We're really suffering. Wahid, please, what is the same thing happening in Yendi? Be more specific so we can pass it on. Alhaji is a health promoter. He's a deputy chief health promoter with the Ghana Health Service. So
big man.
He's the appropriate person to channel all the issues to. We'll wrap up in the bit. This one says. Okay, so somebody taking an exception to what Alhaji said, but you say it's sad and unfortunate. We should know, what we should know is that even if it is happening in other sectors, you can't accept it as a norm in the health sector, because in the health sector, you're dealing with people's lives. I'm disappointed, A.M. Jacob Inwa, and this has to do with the fact that people give others preferential treatments. This one says, okay, so lot of messages, quite a number of you also sent in from the UK. This one says, I'm enthusiastically watching the discussion on health delivery. We didn't include your name, but you're sending this from the UK. We thank you for watching our show. This one says, JB from Rara says, some of these behaviors are political. I don't want to go deep, but my message is that our workers in the hospitals, whoever found him or herself working in the hospital should forget about politics and save the nation. The one who employed you doesn't matter. Put up his or her best, because we're doing our duty to God and mankind. Okay, all right. Somebody apologized, and I think you're a health worker, JB in Rara, because it says, I'm sorry, my dear mom, we don't always need beds to save lives. Oh, okay, all right. So, yeah. But I think you're on the same page on that note, because she shared practical experiences of what happens at the police hospital, for instance, where they have to, make
arrangements. Some makeshifts.
Some
makeshifts.
Okay, we can go on and on and on the whole morning because the messages are just trickling in. But we have to wrap up. We have to say thank you for being here. And we should be discussing our issues more often. I hope that they will be releasing you more often so we can have practical conversation. Because sometimes it's good to know where you're also coming from, so that we can appreciate the challenges from your side as well. Okay, so on that note, yes.
Like I said earlier, the World Health Day, the theme for the World Health Day runs for a whole year. And like we are also requesting, it will be good if on other occasions you can organize certain things relating to the theme for discussion.
Well, we do all the time. We do all the time.
Yes, okay.
But in relation to the theme, then if you have activities, you can tell us what activities are there for the day or for the week.
Yes, we can.
Do you have any activities lined up?
No, but you mentioned the fact that you're launching on the 11th.
Yes.
And there's a press briefing.
We'll follow it up with some feature articles and a whole lot of
things. The regular promotional activities.
Yes, you just want to sustain the awareness about the importance of this, the theme, that the universal health coverage, and come out clearly with the role of the various levels of people, the individual, the community, the government, and the international body, including the media.
And please come out also with a monitoring mechanism. Because we have to be able to. If I go to the children's hospital, for instance, and there's no doctor. Sometimes you said we should be empowered to know our rights.
Yes.
But if you go and ask the nurse, and the nurse tells you that the doctor is not in, what can the person who's asking the questions then?
Will he come? You need to know, so that you can take your next decision. If for a whole day the doctor is not coming, you are an individual. You went there by yourself, so you have the right to know. If the doctor is not coming, you can move to the next place.
Okay,
but you should not be unnecessarily delayed at one point for a whole day.
Okay,
and without any results. Okay. That one is not right.
Okay, we also need the monitoring mechanism, because it is not right that a doctor is not coming the whole day, even if I can go to another facility.
Exactly.
Yeah.
Yes, it's
so
not right.
We should also know.
I don't know the details, so I don't want to go into it much.
Sure. All right, let's wrap up with some of your messages. This one, Dixon says, my suggestion, why don't we use ticketing system to avoid favoritism with regards to who gets served first? This will ensure first come, first serve. Dixon is in the UK, and that's why the tone is like that. Yeah.
But ticketing is even in Ghana, isn't it? And so you go to MTN, you take a ticket before you sit.
Oh, we're talking about the public health facility.
That's what I'm saying.
We're talking about the hospital.
That's what I'm saying. So
because where I regularly go by is a private.
So Daniela is also watching from London. Daniela says, why can't we train nurses to treat patients in need when they have no beds? Patients should never be turned away because this is not the oath they have taken as health professionals. Daniela, watching the show from the UK, thank you very much. This one says it's sad that about 70% of definite diagnosis in the hospital is done by the medical laboratory. Shame on Ghana and any other country that do not prioritize their medical laboratories in terms of staffing and infrastructure. They don't deserve to celebrate this day. Abdul Waris Adam, inside the Janga in the northern region, sending this message. Wow. This one says, the right of a patient is to be treated and the doctors are not there. So what do you want the patient to do? Big question coming in. This one says, Ghana. I regret to be a Ghanaian.
Oh.
And you shouldn't be saying that. You should be proud to be Ghanaian. We have to work on the challenges. We know there are lots of difficulties, but our country is way, way better than other countries. So you have to be happy to be in Ghana. Let's work on it. Your children, your children's children will all come and live in Ghana. The earlier we work together, the better. This one says our hospitals are breeding grounds for infection, unprofessional attitude. Get people sick the more. Educate your staff. Timothy in Breakham. And again, we should also not generalize it because we know there are some fantastic health professionals
who are dedicated
to
their work.
Under very difficult circumstances,
they do their best.
But they still deliver. So we're not boxing all of them and condemning them. We're just talking about the real issues that we encounter every day. Okay. Alhaji, as for the number of people who are not happy with you, they are plenty.
Yes.
This one says for doctors, they need a serious supervisor. Let's just run our public health, public hospitals like the private ones.
Have a management
Mm.
entities.
Okay. Thank you so much for spending this morning with us.
Thank you for passing through this.
But I want to remind Ghanaians again that we are ready for you. Our healthcare is accessible, available, affordable, and it's of quality, but we need all of you to come on board. Because the National Health Insurance, many of them are not there. Please, I'm appealing to all institutions, because you don't know where you find yourself tomorrow. I am a police officer, but I have my National Health Insurance here, and I renew it every year. And I want to use the opportunity to thank all those individuals and organizations, institutions that are helping the poor people to register them on the National Health Insurance scheme. Please, let's sustain it. Renew it for them. And all those who have money and they can assist healthcare, please help us, because health is a human right and it's a necessity.
Okay.
So you need to access it wherever you are. So please, let's help so that the less endowed can also enjoy their lives to the fullest.
Okay.
We thank you very much. Please involve in this year's celebration. Whether we have money or not, whether we are able to deliver on our promises or not, please let's help to celebrate it so that we will address the gaps.
Okay.
We'll address the gaps.
Okay.
Come.
All right.
And then let's see what we can do.
So because of you, I'll come to the police hospital. I'll come and visit.
Come.
Alhaji, thank you so much for your time.
My take-home message is to individuals to be health conscious and ensure that their health is prioritized even within them, and make sure that they live in ways that they will not even fall sick. It is about prevention.
Yes.
Okay. It is when prevention fails that you will fall sick and go. But if you are doing the right things, basic drinking water at correct times, basic eating the right food,
low alcohol,
just no alcohol, no smoking.
Yes. Low consumption.
It could be no.
Alhaji says no.
Yes.
Madam says
yes. And the kidney
so it
diseases
is important.
Are here.
No drug abuse and those things. So it is about the individual making sure that you do the things that will promote your health.
Yes.
And when you do that, you try to influence others within the community to live in healthy ways. Do exercise and be as you should be. Roland has always been like this. I don't know if he's reducing in age or he's increasing.
It's true.
Okay, so we want to wrap up nicely with the health minister addressing some of the challenges that we played back to you with the no bed situation, the situation of no doctors as well. But just to also remind you that we're told that beginning today, you would necessarily require a taxpayer identification number, the famous TIN, before making fresh transactions at the Driver and Vehicle Licensing Authority. So our roving man, Maxwell Agbagba, is on his way, or he is at the DVLA. We'll bring you that report live to see how that's going for the DVLA.